I was walking through the fix department the other day and saw a case that caught my eye. The first thing I noticed was this tray. This is a tray I'm not familiar with. It looks a lot like the Clinician's Choice Quad Tray Extreme, except it's not rounded like it is here. It's kind of a triangle shape, but you can see that it's that same stiff type of metal. And when I try to squeeze the impression tray, even here in the back, I cannot get it to move or flex at all. And so I'm a big fan of, if I'm going to use a disposable double arch tray, I'm definitely going to use one of the metal ones like this or the Clinician's Choice. I'm just not sure who makes this particular one. But what I'm not going to do usually if I'm doing a double arch tray is to take an impression for a 3-unit bridge like you see here. The doctor has requested a material that we just recently introduced called Obsidian. He's going to use it for a 3-unit bridge. This is from tooth number 11 to tooth number 13, so from the cuspid back here to the second bicuspid. And the Obsidian material is on par in terms of flexural strength with IPS Emax. So it's got that same 360 to 400 kind of megapascals of flexural strength. To me, it's almost pushing the limit to do a bridge like that with this material. It should be fine. But if I'm going to do this, I'm going to do it in Bruxer, or you could even consider PFM for a case like this. I think this is at the outside limits of what I would want to do with this material or with Emax. But really the bigger issue is the fact that a double arch tray was used for this 3-unit bridge, and as you can see, we have no other teeth posterior to that last prep. And in fact, we don't see many teeth represented anterior to where the cuspid has been prepared, and that's kind of a problem. So if we look at the model work for this particular case, you're going to notice that we can see the preps pretty well, and they're actually fairly clean preparations. You know, as we look down on it from here, we can see that we are underprepared probably on the lingual surface here. This happens a lot where we go in and the side of the tooth that faces away from us, it's a little more difficult to get as much reduction as we can here on the buccal. So really when you look at this prep alone with kind of the minimal reduction that was done there, that kind of screams Bruxer as well. In fact, if I was the technician in charge of this case, I would look at this and I might call the doctor and say, is there any way we can do Bruxer instead of Obsidian, because we've got some really thin kind of feather edge margins, some very straight up and down walls. And if we make it an Obsidian, we're going to have to make it bulkier. And the Obsidian material, like Emax, does not like feather edge margins. Looking at the Cuspid Prep here, that looks pretty good. That appears to be reduced enough on the lingual. We have that nice concave shape. Again, the margins are a little thin for a material like this, but really the issue comes down to the fact that it was taken in the double arch tray. So let's occlude this model, and we're going to see what we have here. We've actually got, you know, the 2 preps across from the opposing arch, and then literally a third of the tooth in front of the cuspid. So we're seeing just a tiny little portion of this lateral incisor in front of this. And as you might imagine, it's going to make it really difficult to get good function on this bridge. The doctor did send us a bite registration that I'll go ahead and put in here now. I'm not sure, perhaps he was not confident with the bite as registered in the double arch tray, and I'll close the model down into the bite registration. And the pin's all the way down, so you can see that appears to be mounted accurately. But if I open this up and take the bite registration out, and we'll close it again, and I'll just rotate the models around, we can see some space between that lateral incisor and the lower tooth. That space right along in here. And so it makes me wonder when I look at it if in fact the patient is closed down all the way at this point. But you can see that with just nothing else besides the bridge articulating against the opposing model, it's going to be really difficult to go in here and try to get any kind of function and go into any kind of protrusive or anything else. And this is one of the reasons why, you know, we get so excited here at the lab about saying, boy, if you're going to do a 3-unit bridge or more than 2 single crowns adjacent next to each other, please take full arch impressions, you know, upper and lower, because you can imagine how much easier it would be for our technicians to dial in everything. If we had the arch coming all the way over the side, we could verify the occlusion on the contralateral side, and then we could also probably take this set of models through the different excursions and make sure that when you put this bridge into place, you're not going to be bumping into the bridge or anything like that. So Those are my two suggestions for this case. The first one is anytime we're doing a bridge, whether it's just a little 3-unit bridge or say a big 6-unit bridge, we're going to want to do full arch impressions, upper and lower, with a separate bite registration. And my second suggestion would be when we do have a minimally prepped case like this, even though we might want to go with something that on the surface might be a little more aesthetic, like obsidian, if we're going to do minimal preparation like this is the case that's going to call for Bruxer, because Bruxer is really the only tooth color material that's going to be able to handle that kind of conservative preparation and those feather edge margins.